Ladies and gentlemen, world famous Jen Pages. How's it going, Jen?
You're more famous than I am.
Well, yeah, because you haven't been consistent enough on your what is
Yeah.
it? Geez,
My
after,
podcast
not after dark.
off
That's
the
mine, huh?
off the clock.
Off the clock. I can't. You
Yeah.
just told me 2 minutes ago. That's my ADD. Off the clock. And we
Yeah.
got a good idea for you and Felix. I didn't know you guys do pool like that. You both play billiards.
Yeah, and we actually have both gone to like national competitions.
I don't know why you don't do that. You
Okay.
guys shooting pool and talking research. People love that
Yeah,
I just went to Mexico, got my hair treatment done, stem cells,
the
because it's not
trend.
allowed here. And
Uh-huh.
my girl Yomara, shout out to her. Podcast coming soon. And the whole podcast is her doing microneedling on my head.
That's so cool.
Yeah, I'm just laying down the whole time and she's talking. It was
Is
like
it
40
it's like
minutes.
hair transplant thing or just
It's not
treatment? So,
transplant. No, no. It's just microneedling. So basically, like opens your pores. It's supposed to stimulate, and then there
oh,
they have the stem cells. It's not really
mhm.
allowed here anymore because the people were claiming it cures cancer, and people are afraid to use it. But
Mhm.
it's not that it's not safe. But in Mexico, you can. They just order it from Merck or I don't know who, and then they send them to them.
Oh, okay. So it's
But
just
this girl,
okay.
if you ever come down here, I'll take you down there. You just gotta cross the border. You got your
Okay. Yeah.
passport?
Yeah.
You got your sanctity? Rapid entry?
I
Oh,
don't know. I
okay.
don't know what any of that is. I've only
Don't
gone to the
worry.
Bahamas.
Ah, okay. No, no, you gotta go. Well, this is not really like the nicest part of Mexico, but it's still Mexico.
Oh, I don't care.
All right, but anyways, pool, you guys should do because you guys are professionals. And you should have a camera like showing the pool table the whole
Like
time.
different angles of it.
Well, one little screen the whole time, and then
Mm-hmm.
one main camera on you guys talking. That'd be dope.
You move around the table a lot. So you would ha need to have like a
Oh
whole
yeah,
like,
zoom it out. It's not that hard.
oh,
You have
that
the
maybe.
social media consulting. I'm giving you advice.
Yeah, I know.
I'll be a contractor for you if you want.
Okay, there you
I'd be
go.
down. I like that
Yeah, that
side
would be
gig.
cool. We actually got a producer, like someone who's in production and stuff like that, who's won
Daniel?
Emmys. No.
Oh, I won Emmys. Well,
He's not
Daniel.
even he's not even in clinical research, but he actually plays pool with us. He's a pro pool player, like officially, like
Well, there
he
you
is
go.
pro
And then
level.
when you have guests come, they're not gonna be as good, but it'll make it even better. Like,
No, yeah, you wouldn't be able to play with that guy, but I can't even play with him. Like
I
I'm terrible compared to him.
well, that's my idea for you. You guys should do
I
that.
love that idea. But yeah,
And
I'm
then the
gonna
off
tell
the clock was good too. I just haven't
yeah,
seen one in a while. I subscribe. I haven't seen one.
I know we were going to so we recorded three really great episodes and my audio was off.
It's
Just
always
me.
something with you guys on the
I
audio.
swear. Like the one at SOS.
The
Also,
one at SOS, only your audio was good.
oh my,
Felix and mine and Monica's were off.
oh my
So it's just
God.
you talking the whole time with like
You know what?
spaces in between.
I could use that video, maybe. Maybe I could
I'll
make
send
content
it to you.
with it.
I can send it to you. The problem with that one was it was like such a natural conversation, like
I
we're
know
at
it
the
was.
bar or something, and it's like there's not much of that because I tried to like make shorts and
Mhm.
send it to you, but
Yeah,
there's nothing
there's
like
not enough.
nah, there's you need the context for it. But
Oh,
anyways, we're here
okay.
doing it. Jen Pages. So this is what I really wanted to get you on, not to talk about pool, although that's a really good idea, but life after a CRO,
Yeah.
because a lot of people, like you were not laid off, you resigned, if I'm not
Yes,
mistaken, right?
I did.
And you were
I did.
before the trend. Like there was layoffs, right? There were
So
layoffs.
there was already layoffs. I think a year into me working at Icon, there was already layoffs happening a lot, like
Okay,
massive
okay.
layoffs. But it wasn't hitting the project management level yet. It was getting there. So
And you were
it was
PM.
more, yeah, I was a PM at the time. It was more the SMAs or like the CRAs were getting laid off. It was more that. And then it started moving up the ladder.
The CRAs are getting I that one. Do you think they were just overhired?
Um, I feel like, okay, so the industry I feel like has gone down a little bit in the amount of studies that we had. And
Oh,
so I remember before I left, I remember somebody saying, because I was kind of saying, I have a lot of studies, like this isn't okay. And they're like, well, at least you have studies. Because there's a lot of like a lot of people that
mm.
don't have many studies assigned to them, and they're at risk for the next layoff.
And that's even when you take away AI,
Yeah.
global outsourcing, which was happening already.
Yeah. Yeah,
And
but it wasn't, I don't think it's where it's at now. I think in the last year, AI has really like just kind of
oh yeah,
broke out of its shell. When I was in Icon, we weren't even using ChatGPT yet for just formulating our emails because it was told that we can't use it because of
of
the
course.
open thing, because you can't save
Yeah,
confidential
yeah.
data and stuff like that.
They don't want to get accused. I mean, that's just embedded into every email now. Well, even Gmail has it right in
Yeah, exactly.
email.
Mhm.
Yeah, the we're using the worst version of AI we'll ever use today. So it's
Yeah,
only gonna get better.
exactly.
And
Exactly. That's so crazy.
I have a webinar with Jess Thompson where I told her I want to talk about no bullshit of what AI means for you, how it impacts your job. Because I
Yeah.
actually think people are getting bullshitted. Like, oh no, don't worry about it. I actually think you need to worry about it, and then but you can still do something.
I think making sure you're adapting to it is
Yes.
going to be the biggest thing because there's going to be people that are going to just, no, I don't really want to use AI. I don't know how to use it. And then there's going to be a point where we're all going to have to use it. And if you haven't adapted and tried to use it already, it's going to be really hard to understand. And I feel like
Yeah.
that's where it's going to like really affect people. They're not gonna they're gonna choose, okay, this person is probably really good at their job, but they don't want to use AI, and that's how our systems are embedded now. But this person has been using AI for years now, maybe not as good as her, but maybe with AI she can be more efficient. So who do you think they're gonna pick?
Well, of course, but the whole time they're telling you not to try it. And then there's a tipping point
Oh,
where they say, "Oh yeah, now only the people that are good at it." So it's
I know,
like
exactly.
that just
It's like
shows they
a
don't care about you.
catch-22.
They care about their outcomes, and
Yeah.
um, that's the bottom line. But that's no should be no surprise. But so
No.
you resigned,
Yeah.
and now a lot of people since then a lot of people have been in the same situation, although they didn't resign, they got laid off or they're in between jobs. I actually know a lot of very experienced people, which I would consider you one of them,
Mhm.
that were working at CROs and now are not.
Yeah.
You
Yeah.
know,
I did a post about the layoffs and stuff, and the amount of people with so much experience and so much knowledge in the industry that don't have jobs right now is really insane.
okay. So what do they do?
So they just keep applying to places, but I really feel like there's so much work freelancing that we
Yes.
all kind of shouldn't be struggling like we are, you
But do
know?
you think that it's for everyone?
No. I think there's
That's
going
the
to be,
problem.
so this is what I feel like. I feel like there's people that are meant to be in corporate jobs. And I feel like
Yeah.
there's
Yeah.
people that are not meant to be in a corporate job that maybe they can do things on their own. But I feel like it takes like a certain person or a certain place in your mind, like a mindset almost, where to be a freelancer or to be able to do like open up your own business, it takes a lot of heart and a lot of like
A lot.
persistence.
But the rewards are
It's
incredible compared to, I mean, no cap on your, not like the Gen Z version, but no cap on your earning potential, right?
yeah.
I couldn't think of a better word. So, but there's no cap on your earning potential, and you literally are not handcuffed to our income, our
Yeah.
income. Like you can leverage your skill set. I think
Mm-hmm.
I have this analogy of like when you go to the grocery store in the frozen section, you buy like juice concentrate.
Mm-hmm.
So like when you are a CRC or a CRA, you're essentially becoming a concentrate. And if you notice, the main people doing the work, I know you were a PM. You guys
Yeah.
probably somewhere right on the edge, but the CRCs and CRAs, they're the ones doing 90% of the work.
Mm-hmm.
Everyone else just managing, oh no, you didn't do this, you didn't do that, but they're not actually doing the work.
Yeah.
And so that's that concentrate that you can then get some water and dilute it and like make jugs of this stuff. And that's where I think like being a consultant or a business person or a freelancer or a site owner is beneficial. And I think you're an example of that. I mean, you have a site now.
Mm-hmm.
You are doing consulting,
Yeah.
freelancing for I mean, why don't you share some of what you're doing and what you think of this concentrate analogy?
Yeah, so I agree 100% with what you're saying. Like the concentrate analogy, it is the CRCs and the CRAs mostly doing the bulk of the work, but
Everything. It's not fair.
it's not. But I also feel like there's a lot of times where CRCs and CRAs alike are skipping corners, and then it creates a lot of the bigger issues that there
Mm,
are in studies and then in like in research, right? So
good
it
point.
trickles, right? So like just like things trickle down and it ends up being CRC or the CRA's fault, the same way it trickles up. And so like as a project manager, when I was at Icon, if a CRA didn't do something, it's my fault.
Okay.
You know
Fair
what I mean?
enough. Fair enough.
So I had to take the blame that I didn't lead my team well enough that they knew like to do these things, right? But if you really think about it, right, I feel like what's wrong with the industry is we're all trying to cut corners in both sides.
Hey, nonsense, Jen. Stop accusing me of
Oh, but
this.
listen, but just hear me out. So like the CROs are just designed the way that they're designed is just terrible. It's not like efficient. I don't know if that makes any sense. It's
Wow.
efficient in a
I'm
sense, but
supposed
it's
to be the
not.
controversial one. This is great. So
Well,
they're
it's
not,
because it's true. So
all
like
right.
you should have one steady team, right? But like that team, they should kind of work together frequently, right? And they should always be in communication. Like that's just what I feel like. A good team is like that because I get information and I should, hey, CRAs, like this is what's happening. This is what I heard from the sponsor. I just want everyone to be aware because their is affected by it. What they have to do is affected by it, right? But I feel like in CROs, since they're so big now, like there's that missing, that gap missing, and there's not people that care enough to fulfill those gaps to really
Yeah.
make the teams flourish. So like the budget team is like a completely different department. They're not even in the same department as, let's say, Legacy Icon is, let's say, one of
Yeah.
the things.
Yeah.
They're not even on the same team. So we don't work with the same budget person all the time. If we work with one in one study, it's always somebody different or every time. Like it's different. It's not like the CRAs. The CRAs are it's
Right.
more consistent because they're more on therapeutic areas and stuff like that. So you're usually working most of the time with like the same people overall. And so I feel like these little things that they have made to try to make it more efficient is actually not making it efficient. And it's actually trickling down where it's causing a lot of delays with startup. It's causing delays with even maintenance. And when there's database locks and all that, it's also causing delays. And
Well,
I
the
feel like the
thing is
same
like
thing,
efficient
uh-huh,
for who? It's efficient for them.
everyone. No, it's not. It's not even efficient for them.
No, no, like initially when they created it,
Yeah.
the idea was not how do we make this more efficient for Eli Lilly? The idea was how do we
Yeah.
make more profit for ourselves
Mm-hmm.
and then just enough efficiency for the sponsor that they don't choose someone else.
I agree. I agree. But I feel like that's where the gaps have been. And so like a lot of times when I was in Icon, they put me on those studies that were in escalation. So it's those studies that the sponsors are so tired of what's happening that they're about to like
They're
go.
pissed.
Yes. And so
So you've
I
been
would
on
come
calls with
in,
these sponsors?
yes.
What are they,
And
what was their biggest complaints usually? Like,
their biggest complaints is communication and follow-up. So like
but from who?
um
From who? Like what?
from the study teams, let's say. Like they're like, oh, the site's we don't know this information yet from the site. Why is it taking so long to get regulatory documents? Or why haven't they entered the data yet? Or what like and it'll be questions that every time you meet with a sponsor, they're over and over and over again on the agenda as problems.
Mm-hmm.
If you meet with a sponsor biweekly and you've already met with them 8 times and this thing has still been on the agenda, like that's a problem, right? But the problem, I think, is everybody's pointing fingers. Sites blame the monitors blame the sites, and then there's no real clear indication of what it is. But it's also, I feel like the study teams, a lot of them don't have the site experience, or if they do have the site experience, they don't speak on it. So when I was a PM, I was defending sites because I had already been on the site. And so like when there was like, let's say labs that were coming out a little elevated, I was like, well, I know this from a site level that when you ship labs, especially in summer, a lot of because of the shipping and the shipping conditions, a lot of the times the levels come out wrong.
Hmm.
And because of the heat and it changes it. And then they were like, really? Even like the lab that we were using was like surprised that I said that. And I was like, you have it on your forms.
Yeah.
Like it says it on the forums that this can be elevated based on weather. And then I was like, so it's something that we all should know. It should be something that, and it helped to, what we ended up doing is using a local lab for specific tests.
Local labs are so much better. It's just sites. It's really hard with local labs, because you have to make the workflow yourself,
Yeah.
and that's where becomes other, I guess, bottlenecks. So it's almost like which one's worse.
Um, it depends on the study, which one's worse. So like for that study, it was easier because they weren't going to read their enrollment goals and it was a requirement to meet it by a certain time
Hmm.
in order to get it approved.
Yeah.
So it was one of those things that I like for that study, it ended up turning out to be better using half local and half central. Because the
Yeah.
local lab, I think the one that it was like a hematology panel or something like that.
But even then, there's always a downside. You're giving the coordinator like another portal to log into and another thing to
Yeah,
forget and another
yeah.
thing to. This is why we actually need AI in this space. Like this
Hmm.
things are getting more complex, not less. And at the end of the day, who's doing the work? Coordinator and CRA. And then when they don't do their job, who fills in? The PM or the CTM. So it's
Yeah.
like that's basically it.
But I
Uh,
feel like if everybody was more like involved and more in tune with the why of things, I feel like it would help a lot.
do you
Like,
think it's a problem worth fixing, or do you think sponsors are like, you know what? We're gonna just start using this tech ourselves and start managing sites directly, little by little.
well, what they're doing. So there's two things that they're doing. They're either looking for networks that provide that help, where they only have to send everything to one person and that one person helps them with everything.
And that's from the site too. They're paying for it.
And the problem with that is the budgets are way more higher that way.
Yeah.
Like
Well,
they have to,
higher than with using a CRO?
yeah.
I would imagine they're way
No, no,
lower.
no, not for the sites. I mean, for
Oh,
the
for the
sites, they're
sites, yeah, of
so
course,
high.
of course.
Yeah, yeah. So I mean, it
Yeah.
ends up helping the site out when they can do stuff like that.
Yeah, yeah. Uh,
So, and then what they're also doing is they're looking for sites that they don't have that are low maintenance sites. Sites
yeah,
that they don't have
yeah,
to tell to do all these things.
yeah. And
So
and
that's why they're
before,
being pickier now with this. That's why new sites are opening and they're closing because it's like they can't get studies because sponsors are being so picky with who they work with now that it's been like,
sponsors are picky, yeah.
yeah, they want to work with sites that have made their lives easier, not harder.
And so really like this efficiency you're talking about that the CROs were supposed to offer, the sites are now supposed to offer it. And if the sites are not offering it, they're out of business or they get
Mm,
rolled up or
yeah, yeah, and I feel like we just have to it's the same thing I think with everybody. I don't know about you, but I like excellence. I like things that are I like to work with people who kind of make things a little like easy on me and I'll make things easy on them. Like that's what the whole exchange is for, right? So sites
Mhm,
are supposed to we're in business to serve these clinical research studies, right? To
mhm.
serve these companies and collect this data for them the best that we can. So we have to picture like a business, right? So there are clients. We should want to do what they are asking us because they pay us. Now, if they're asking us for more than the scope of the budget, then we need to say, hey, we need to renegotiate the budget. I don't mind doing this with you, but maybe we need to go back in the budget and see if we can increase some costs because now this is extra work than we initially agreed to. you know?
Yeah, yeah,
And I feel like that's kind of where everybody's forgetting that it's a partnership. They're our client though. And as much as they're supposed to help us, it's really they're hiring us for our expertise.
of course. I mean,
And so if you tell them, it's like I was telling my brother. My brother's like, "Oh, why don't you guys just make source documents?" I go, "Why? We're hiring your expertise to collect this data because you see patients day to day. We don't. Most of us have never seen a patient in our life. And you see the patients. We don't know what you need to collect in order to gather the information that I need from you. That's why we're trusting you and paying you thousands of dollars for you to do it for us."
yeah,
And it's kind of like I feel like the everybody has kind of shift their mindset and think like we're doing them a favor. No, we're we're serving them. They are our clients.
yeah.
And but I also feel like sponsors are also for their business not being efficient where everything like they're having the protocol, for example. This is like a big thing, right? So having the protocol where they don't have to revise it 20 times, that's important for them, for their own business, for their efficiency. And it trickles down because if they're going to give us 20,000 amendments, then are they a good client for us? Can we meet their expectations? Which
Right.
if their expectations are unrealistic, we are allowed to tell them, hey, look, these expectations are a bit
Oh yeah.
unrealistic. We're on amendment 20,
Especially
and
when those studies are like the ones that don't pay much. Then you're
yeah,
like,
and so
we're not gonna do this.
exactly, and so but that's the thing. I feel like sites get studies just to get them, and
Yeah.
not necessarily because it's the best for their business.
I'm telling you, not the site networks. I mean, they're slowly taking over the CRO market share.
But they're not delivering. When they become like at a certain level,
Do you
at
think
least
they are not yet, or is it too early to tell? 'Cause I don't know
I,
where this data is coming
it's not
from.
going to be sustainable. Just because what I've noticed when I was a PM is I hated working with the networks
But they're in
because
their infancy though. What if they like give them 5 years? Do you think they?
it's when you get too big, it's really hard for you to manage individual sites to really give the quality that we should be
Hmm.
at,
So they
that we
basically
should
become a new version of a CRO.
of a big CRO. Because the little CRO, the smaller CROs, it's more,
Mhm.
they're more interactive. There's one person. Yeah, they might be a little overworked, but that person's really knows their
And
stuff.
that person probably paid well too.
Exactly. When you go bigger, where the communication starts lacking. And I think that's the
Yeah.
biggest thing. You can grow and be great, but I feel like you can only grow as far as you can communicate effectively. Once the
Yeah.
communication is being hurt, like then you need to worry about how can you make sure that communication comes back up to par.
You know what else besides communication? I mean, I like that. You explain it pretty well because
Mhm.
usually it sounds like a cliche, but the way you explain it actually doesn't. It makes sense. But I
Yeah,
think if you boil down that communication, actually there's a deeper issue at these
yeah,
bigger places, and it's a lack of responsibility because there's so many people. They're like, yeah, someone else will do it. Whereas at a smaller one, it's like
see that.
it's only me or my manager, and if I don't do it, they're gonna write me up or get rid of me.
I see that. I could see that. I could
So
see
the lack of
like what you're
communication
saying
is
now.
really lack of responsibility. There's too many people.
Yeah,
So maybe the layoffs were necessary.
I feel like then lay off the ones like that are not doing great.
I mean, I'm sure they did. I know they laid off
Oh,
some
they
that are
did a
doing great too.
lot of people, even great people.
Yeah.
I remember I was working with a SMA. She's amazing. I know that she has a job now.
Yeah.
I mean,
Who hired
amazing.
her? Like what type of company hired her?
Icon. I,
Oh, she got hired by,
after
yeah.
Icon, after she got laid off,
Was it a sponsor site?
sponsor,
Sponsor?
sponsor.
See, I think that's next. I think it's site networks dealing with sponsors, dealing with a bunch of small sites and all these vendors like Creo and Nato. I think that's the future. Patient Ace, shout out to shameless plug.
Yeah, but
I think
just
that's the future.
remember, things in research are they cycle. So like there was another time that they weren't using CROs yet, and they started using them again, and then they stopped using them, and it's kind of like a cycle based on the work. So like the work starts getting good, and they're like, okay, wait, we're doing great now. Let's build, let's do this, blah blah blah. They just start, and then the quality slowly goes down, and then the sponsors switch out, and then the sponsors realize how much work it is, and then they want to come back,
Yeah. This
and it's kind of
it
like,
flux, right? But I think at some point the tech makes it so easy, at least the communication
mm,
part. So you got like
yeah,
a dashboard now. You don't need a beg icon, give me access to the number. You just plug it into the sites. Like
yeah,
I know I don't need to wait for some CRA to tell me why there's no query. I see it here and I could
yeah.
actually query them back. It's a
Mm-hmm.
matter of standardizing, which I know people are trying to do. And that's a whole nother topic of standardizing systems. I don't
Yeah.
think that's gonna uh, play out because there's too many stakeholders. But um, essentially, when you standardize systems, you're creating a monopoly. And I don't know. I gotta interview a few people on that because maybe there's something else there. I'm not
Yeah.
like a huge bull on that kind of stuff.
Well, I think with AI and like you see CEOs and the efficiency thing, I feel like the only reason why it will impact jobs is because you're gonna have one person that's gonna be able to do more work,
Yeah, yeah, yeah.
basically. So I feel like in that way it would affect the job, but and it just makes you, I guess for me, it just makes me want to not only use it but like work harder. So like you still have 8 hours a day though,
No, you
and that
got
doesn't
more.
mean
Are you
like,
crazy? If you work for yourself, that's
oh.
not 8 hours. 8 hours is like your lunch break at 8 hours.
But look, then you have these business owners that they'll spend 4 hours on their thing a day and then go and then wonder why their business isn't growing like how it should.
Well,
And
because
it's
yeah,
like
yeah,
if you dedicated 8 hours for a job, like you know what I mean? If you
yeah,
dedicate those same 8 hours to your business, like the same though, like not sloppy, but like the
yeah, like
same
hardcore 8 hours.
hard work hours, like you would get so much done. In the beginning, when I started working, like started building my business, right? When I first left Icon, I was working like 24 hours almost. Like I think
Mm.
if I slept 4 hours, it was a lot. But you know how much of my business grew, like how fast? And then it's not that you get complacent, but you start hiring out or whatever, and then the person is working these 8 hours, but not really doing as much as they should in the 8 hours, right? But you think they are. So you're just like, okay, I get to spend the day with my kid
Yeah, yeah,
today, or
yeah.
like, you know what I mean? And then I feel like that ends up being where people fall because you have to keep dedicating that
You have
time
to
to
have
it.
somebody accountable to you. We had
Exactly.
those issues at my site too, and we have a QA person now, but we have Monday, a tool called Monday that
Love Monday.
you use it?
I
Yeah,
love
it kind of keeps everyone responsible. I at least know, even if I'm not at the site,
Yeah.
who did what, why it's not done. I could leave comments, and I think that's something that sponsor eventually can plug into something similar to that with sites.
They have an enterprise version
Yeah, yeah,
of Monday
yeah.
and it has a lot of tools. Have
Oh,
you
they
ever
got a
used
bunch of analytic. I have the one tier you pay for, like the first tier you pay for.
Oh, well, just a plug to you. You should try the CRM.
Yeah, I know. But it's just
Well,
to like
we
track
can talk about it later.
it's the track studies.
Not the CRM. The CRM would be like your outreach. It's
Oh,
really good
patients?
for
Well, we
development.
got
No,
patient A's
well, for no for business development, like for studies.
for study. Okay,
It
okay.
would be like I can show
Yeah.
you, but I can show you. It makes
It
business
makes
development
following up easy with them. We might upgrade to that one because I don't have the CRM on it. I have just the workflow management thing
the work management one. Yeah,
with the uploading files, and I mean it's pretty damn cool.
it's really good.
Yeah,
I have to
Monday's
show you.
great.
I love how it's automate stuff too. So like you can put like once this task status changes to this, send an email, and then you can even put like the person you want it to send to.
Well, we love it, but they don't sponsor, so let's not pump them up more than they should.
Okay.
They've been ghosting me. I've been like, look, let's sponsor the
Oh no,
pod.
no, no, no,
Uh,
no. Monday sucks. I'm kidding.
but it's good segue. You transitioned life after CRO. Now, you were a coordinator before a PM,
Yes.
right? And
Yeah,
then
I was a
now,
coordinator. And then I went to CTM and then I became a
oh,
PM.
CTM. Coordinator at a site, CTM, CRO, PM, CRO, site owner, slash a whole bunch of other things.
Yeah.
Uh, do you think life after being life after working at a big CRO is better or worse than a stable job with benefits and just clock in, clock out, and no worry about things in between? Although that's not really how it was, but you know,
No, I feel like I like both. I loved working for Icon and like serving my like their clients, the sponsors, and like trying to make sure that their study ran well. Like that was so important to me. It would take it on like if it was my own study. Like if I was the owner of the study and I was gonna be the one making like all the money, which obviously I'm not, but and I feel like it all depends on your passion and like where your heart is. Like I just love helping people. And so like even with my own business, I don't look at it like I'm building a business and this no, I see it like I'm serving people and like I'm able to serve people the way that I want to serve it. And that's why I like that I have my own businesses and that I'm consulting or that I'm helping serve people because it's on my terms and it's how I feel is the right way because there's a lot of times that maybe I didn't agree with the way the CRO made me do things, you know?
sure, but most people, well, there's not too many gen pages, first of all. A lot of people just want to get paid, earn an income, and then they naturally want to earn more, right?
Yeah,
And
yeah.
so then they get laid off. And then they're like, okay, I'm not earning more, obviously. I have no income now. What do I do next? And it's like
I would
I can go
re-
freelance. I can work for a sponsor, I guess. They're the ones hiring or tech vendors. Well, like what would you
I would apply to sponsors because there is more work balance than a sponsor
Yeah,
side.
yeah.
But but I would do freelance work for sure. If I was somebody who got laid off, I would start freelancing. And then in that while you're trying to get a job, you're freelancing, then you have enough time because it's gonna take a while to get a job. In this industry right now, the way it is, it's gonna take like 6 months maybe.
So how does someone just freelance? Like they don't want to do a podcast. They don't want to be as vocal as you maybe they're not as funny as you with memes on LinkedIn. You know, what do they
Yeah,
do? These are people not used
just
to.
message people directly. There's so many people on LinkedIn talking about their clinical like upper that's not working well or that they need help with this or that they need help with certain things. Like, one thing that I think I'm looking forward to start implementing not only in my sites, but I'm also, in the consulting, like the sites that I consult and stuff like that. Um, I was actually gonna start seeing if I can form a team for just data entry or source document creation, right? You know how many sites would love like to
Yeah.
have someone to just do data entry? You know how efficient your site
Or
would be?
following
Your
up on patient
coordinators,
leads.
yeah, your coordinators will not be so overwhelmed,
Yeah.
one.
Yeah.
And two, you're giving someone like, data entry work that is gonna one help them because they're freelancing they need, but it's gonna keep them moving and it's gonna keep them
Hmm.
inspired to be in research too.
They're saying just approach sites because I think in 5 years data gets entered passively. You're like in that meantime, if you need to make money, because AI is not doing that right now.
Mhm.
Yeah, that's smart actually. So you would just approach sites,
Yeah,
probably not site networks, but just small sites.
you could do site networks. You could approach anybody.
I
There's
think the site networks will have their people already.
if it's not really. So like if they're owned privately, like if it's like a site network that they have 12 sites and it's like one guy who really owns all 12 sites, for example, they might
Brad,
need
is that
no,
you
it was
just
somebody else.
described Brad?
It was somebody else.
Ah.
He's been
Okay.
on your podcast too, but no,
Ah,
it was Brad. But I'm sure he would probably consider data entry.
yeah.
I actually was thinking of starting to provide that as a service and like put $10 per visit we enter for you data entry.
$10 a visit. Wow.
What does that seem like a lot or little?
That's very little. What do you mean? Who's doing this
But
for?
but if you really like, I did all the math, so like I've already.
Would you
That,
outsource this overseas or what?
um,
That's what
maybe,
everyone else is doing.
maybe, but I think what's the most effective thing that I've been noticing is there's a lot of people that want to get into clinical research and don't have experience, so they're not getting jobs.
Yeah, yeah.
I
So they
really
could put
smart
this on their
people,
resume.
and so what I've been doing, kind of, is I've hired a couple, not hired, but I kind of got a couple interns, and I'm training them, like kind of mentoring them through the process, and I was thinking of getting them to help, like show them how to do data entry, show them how to do lab processing, but like, kind of like
Jen
having
Pages
that
is entrepreneur.
hands-on
No wonder
experience.
you quit Icon. You get ideas.
I told you, Dan. I told you.
So
Okay.
how is it that you got ideas enough to not just wait till you're laid off, but you just resign, and somebody else they get laid off and they're freaking out?
I was thinking about it. I had been thinking about it for
What is
like
it?
over a
Is it like
year.
your brain or what?
It's just like I've been like, how can I make this better? Like that's just the way that I work. Like everything I'm presented something that's not working and I figure out, I don't know, I get one that does work and I get the one that doesn't and I'm like, what's the difference? And then I
We
just
gotta
try to figure
figure this out because I think a lot of people that are laid off now, this new wave, are highly educated.
oh, they're so smart.
They've been trained to not color outside the lines. That's the problem. And they've been rewarded their whole lives by staying in the lines. Soon
Yeah.
as they get laid off or they have to do something for themselves, like I get these messages all the time. Oh, am I allowed to do that? Is that okay? What do you mean? You have no income. Everything is allowed right now.
Yeah.
Like
Yeah.
you shouldn't be asking if it's allowed. You should be trying to see if you can make some money here off of this.
Exactly. And even like you said, like I was even thinking patient recruitment. That could be outsourced. You're just
That's the
calling
Wild
people,
West still.
but you're just calling people on a list, seeing if they want to come in
Yeah,
the study,
yeah,
getting to know them. It's all communication.
yeah,
In other businesses, they have what's called closers, and I feel like
yeah.
that's very similar if you think
Always
about
be closing. You seen the movie Glengarry Glen Ross?
it. I
Ah,
have.
that's a classic.
Yeah, so
Coffee
I
is
mean,
for closers.
so if you think about it, it's kind of like a closer with the patient. Patient already expressed interest, so the client already kind of expressed interest, right?
Yeah,
And so you just have someone calling, giving them information about the
yeah.
whatever it is, getting some information from them, and then you schedule if they qualify. So,
Another thing sites need help with that you're doing is so we just gave people who are laid off maybe three ideas.
mm-hmm.
The data entry, the following up with patients. Well, two ideas, but you have
Yeah,
way more. So the
I
next
have,
one is the social media. You have social
yeah.
media.
So
I'll be a contractor for you if you want. I'll come in and give people ideas.
yeah, that sounds
You
good.
play pool, you jump in the pool. Uh, this will be good
Everything's
pods.
cool. The site's name, Pool Research. Okay.
I'm telling you, this stuff would work.
No, yeah, and so with Clean Social, my whole thing is like there's so many people
I
in this
gotta look
world who
this up. Clin Social.
don't know about research. Tell me no. Like they say only 6% of people who qualify for study even know about it. 6%. With social media out
Wait,
there,
Clin
how is
Social
only
Media Marketing? Oh yeah, you're right on the home page. Dang,
yes.
Jen, you everywhere. How do I not how do I not know about this?
So I initially made Clean Social with Clean Social to spread the word, educate people about clinical research, what is it about, try to put more trust in the industry because a lot of people who don't know about research really don't trust what we do.
Hey, here we go.
So, and also I wanted to help sponsors and sites where I can put them out there in social media and we're building trust along all of our communities.
Who are these people?
Those are the social media managers that I have.
Dang, you're
Yeah.
prepared.
So,
It's no
and
wonder you quit Icon. I mean, for real.
I just had like ideas of ways I know that I can help like the
Your
industry, the whole.
digital voice. So are sites hitting you up about this?
Yeah, yeah, they are.
You know what they should do? Uh, I'm down to be a consultant for you, by the way, but they should
Okay.
do local interviews with people, like I did with Yomara this
That's what I
weekend.
said. Yeah, I told them.
Nothing about research. Just in the beginning, all I said was, we have studies for this, and this. Text right now if you're interested, and let's get into the interview. And at the end, I close with that too. And then
Yeah,
underneath, I have link. That's it.
yeah, exactly. And I feel like a lot of people are not understanding the power that it has. Did you know that sponsors are now looking at people's social media, like sites, if they have a social media account?
GSK looked at our TikTok because
They're
we did a
starting to
webinar for them. Yeah, they're
they're
starting
starting
to.
to look.
Yeah.
And so tell me, I
I feel
at
like we
least,
got a study from them just because of that TikTok with like 50 followers, or maybe Grecia built it up to more.
but think about it. How many people are using social media a day? All of us.
8 billion or maybe 7
All
billion.
of us. All of us are. And so like, I don't know, I feel like we're wasting so much opportunity. Like, you know what it is that a sponsor can just go on my Instagram account, let's say. They
But
could see
site
the
owners
whole
think it's a waste of
walkthrough,
time.
huh?
Site owners think it's a waste of
And
time.
it's not.
I know.
It's not. Like for me, for example, right? You can see the whole walkthrough of the thing. You can see all of our capabilities. You can see how
Yeah.
it's gonna look. Then I was even thinking, let's have interviews with some of the staff, asking them questions so that we can bring some trust into the industry. So telling a patient, so you have a video where you're like, hey, this is how we do the ICF, and I want you
Yeah.
to know it's completely
I gotta
voluntary.
share this. We gotta plug. I'm not gonna play the sound,
Ooh.
but basically, Katie walks around our office,
Yeah,
and then I walk around like our other clinics. And like patients have
exactly.
said, it looks sketchy until I watched the video because then I knew it was like real people involved. Yeah.
Exactly. And that's what I feel like people need to see and understand. And so that's why like I made that because I wanted to help sites understand like how credible that makes you. It puts so
Yeah.
much trust in you.
It's 2025. I mean,
Even
I've been
doctors,
telling people this in 2015, but I never
yeah.
had a social media consultant. This yours is top notch.
Well, I did it because I was looking for that. And I was
And you
hiring
couldn't find it.
I was didn't have any idea about research and so it wasn't working.
Yeah.
And so I was like, why am I hiring people? I know about research. I know like the needs. I know what the like confidential stuff are. I know what all the regulations are. So it's like, why don't I help people build their
For
social
your
media?
site in Orlando, are you interviewing like local businesses or what are you doing?
So I haven't started that yet with the social media
That'll
for
be fun.
so
That works
yeah.
and it'll be fun for you.
So what I want to do is not just interview like other companies, like companies in the area, but I wanted to interview doctors, even if they're not in research.
Yeah, 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 yeah.
And just kind of get like their feedback on so I want education. I want to put education out there on not just
At the
like
end of the day,
medical.
if you're a site, you're responsible for educating your community. Not Eli Lilly,
Exactly.
not IQVIA. They don't give
Exactly.
a fuck. Well, Lilly might, but not the CROs.
But they should. And then I'm also there if they want to do stuff like that. So that's
Mm.
why I even hired, like, we have a partnership now with a producer where he's part of Glen Social. And we could do
Wow.
all of this. Like, we could do such professional videos
Lynn
now. Like,
Social.
he won, he's won Emmys and everything. I don't want to put that out there, you know, throwing a little plug for me. But so we can do very
You're gonna do like
professional
a
quality.
office style show, like a series like The Office?
Yeah, like we could do all of
Who's
it.
Dwight? Felix?
No,
No?
we
Who's
haven't
Michael
added.
Scott? You'd be
Who's
Michael Scott from The
who's Michael?
Office. You don't know The
Oh,
Office? You're Michael
yes, but I
Scott.
didn't know what you were saying. I was like, what are you saying? Yeah, I don't know who I'd be. Do you think I do?
I have an idea with the one of our clinics, not the research, but the clinic where I know all the MAs and the providers, and I was like, we should do a office, like a documentary, like a mini office series with us as
Yeah,
characters.
yeah.
But we'd just be ourselves though.
So I had an idea, and I told everyone about this, and we're gonna do it. So whatever, everybody's gonna hear it now. But it was gonna be Love Island, but the clinical research version.
What are you gonna do? How are you
Okay,
gonna?
so the sponsors are the girls,
Ah,
and
okay.
like the sites would be the boys. So but it's gonna be just pure comedy. Like it's not
Yeah,
gonna
yeah,
be.
yeah.
It's
There's
pure
no
comedy.
drama.
Yeah, it's like, oh, I just came in the villa. I'm Eli Lilly, let's say, but I'll use like a different name, for example. And it'll be like, oh, I like things. very complicated, but I like them done right. Like I don't know, like something like that.
I like it
That would
messy.
really. I like it. I'm a little dramatic and messy. I don't know, like like just being funny, and then the sites would be the boys. It'll be like, oh, I really like that study from Eli Lilly. They're looking really nice, right? Like kind of just play with it and just be like, oh, I'm gonna pull them for a chat.
That's risky. I'll
It
tell you right
is.
now. I think I'll
It
take
is.
my office one. It's less risky.
So I love it though. I love it because it's just comedy. It's
Yeah.
not
But the
like for
point is, like,
research
sites should be
comedy.
doing something. Like,
Yeah.
there's plenty of
Yeah.
downtime at sites, especially in between studies,
Oh
to
yeah.
where you have to have your coordinators maybe do some out of the box stuff. But okay, so social media marketing is another
Yeah.
thing people can do, life after a CRO.
Definitely. Mm-hmm.
Obviously, the traditional stuff applying for sponsors and I think tech vendors.
Yeah.
I don't think if you get laid off by one CRO, another one's hiring you. I think they're all kind of on a very
They're all,
hard to get a job in a CRO right now.
I think even sponsors too, but
Hmm.
I feel like sponsors are more just being picky because there's a lot of people to choose
Here's the
from
thing
now.
about sponsors though. I know like it's polarized with the new FDA,
Mm-hmm.
whatever. I think they're making the environment conducive to biotechs, making it easier for biotechs a little bit. And so I
Mm-hmm.
think you're going to see more smaller biotechs like growing, and they're going to be the ones hiring.
Yeah.
Small biotechs.
But I've also seen a lot of acquisitions.
Well, yeah, that
I
happens
feel like
later, but that's part of it. But that's like, okay, you join the biotech when it's like 50 to 100 people.
mm-hmm.
They grow to like 2,000. That's a 3-year window. And look
Mm-hmm.
at, you probably will become like the next Robert Goldman after that. Like
That's
if
true.
you're employee 50 and it grows to employees 5,000 and then
Mhm.
AstraZeneca buys you, okay, whatever, you'll be a cog in the wheel. But like you can go somewhere else now.
Yeah, now you have a higher position.
Yeah. Or you can stay AstraZeneca. It's not bad. I don't know. I never worked there.
I've never worked there either. Haven't
It
I?
sounds like hell for me, but maybe it's fun.
I don't know.
I'll take
Sponsors,
my bet that it's not fun, but uh
sponsors, job like with a sponsor scares me. Even though they say a CRO is probably a little harder. I don't know.
I think the
Scares me.
CRO would be ruthless to work for. Unless you're like
Yeah.
top in the top level somewhere, like let's acquire these sites. That'd be fun. I can do that. Or like let's make the next tech thing. I can do that.
Yeah, yeah. Like those innovative ones.
Yeah,
Yeah.
but if you're asking me why this site didn't sign 3 SUSARs, I'm getting fired on day one.
Yeah. Oh, you know what? I just thought of another idea. They could
So
do
we have
train.
four so far.
They could train. If they're really good at research, they could do
Look at
training.
Jess Thompson and them. And
Yeah. Alicia Moore.
Alicia Moore, she's gonna
Mm-hmm.
be a site owner. I've had Zooms with her, private Zooms. She's doing this research training. You know how many people are doing research trainings? Like, as someone who's had one for 10 years, and we're with the LICR girls, we're revamping them, but
Mm-hmm.
that's wide open. Like, Jess Thompson just did a free GCP AI one.
Yeah.
Okay, so that's a fifth one. But
And
there's a
it doesn't
sixth.
even have to be like you make a course online. You can literally go to sites like in your neighborhood and say, "Hey, do you have trouble like with your site, like with your coordinators, like knowing how to do everything or whatever?" And you can literally easy get a
Yeah,
job
yeah.
like that.
If I didn't know my QA person, I'd be the first person that walked in. I would be like, yeah, definitely.
You'll be like, you
We
know
need
what?
that.
What do you have to offer? Like. And so I feel like there's a lot of little things you could do, even just locally. Like, let's say
Hmm.
walking into, and most research sites, you tell them, hey, do you want me to train your study coordinators? They're
Yeah,
going to let you do it
yeah,
because you're going to teach, even if you teach your coordinator how to do two things that they didn't know how to do.
yeah. You
Like,
find a
that's a
site
lot.
owner. Hey, I just had a newborn. I can't go to the site every day anymore. You walk in and tell me that, you changed my life. You know?
Hmm.
Don't do it because I already got someone, but
No,
it's in theory, a hypothetical.
don't go to Yuma or
It's
Hermy.
hard. The good thing about being here is it's very hard to get to. Like,
Yeah,
just a few people wandered through here and there.
yeah, yeah, exactly.
So that's five. Number six is something you've done already. through, I mean, I didn't even know you did this. I might have talked to you about being the QA person, but I didn't know.
Oh yeah.
QA,
Yeah.
quality assurance. You
Hmm.
want to talk about the demand? Like, okay, so you fly from Orlando to Phoenix
Hmm.
to help, just as one example. I don't know how many clients you
Yeah.
have, who's a site owner. Like, that means that Lee trusted you enough to fly you out, I don't know how many miles. It's not local to
Hmm.
do the QA. That means there's a demand, supply and demand.
And do you know what the root of a lot of issues are, which is that we could do number 7, is source document creation.
Ooh, we got,
So,
we could probably get to 70 of these things.
and see, these are things that I provide at Clit Mastery that I don't
Hold on, let
like.
me look at that website. Hold
No,
on.
I
Clean
don't, I
Mastery.
don't, I don't kind of like, I don't promote it well enough. But these are all things that are part of like the list of things that we can help with, right? And
Yeah,
we just,
I see that
and so that
website.
means I'm gonna have to start hiring people in these things too. I'm gonna want the best of the best too. So like, there's so many options and like, but there's so many sites too. Like I'm not gonna be able to help everybody do source document
Look at
creation.
Clean Mastery, guys. We got to, I'm gonna get you some business going, right? Smarter clinical trials start here. This is amazing. Let's accept cookies. I trust you so much. I accept all your cookies.
You
All
can
right.
have the cookie jar. Kidding.
40 plus sites. So talk a little bit because this is number 7
Yeah.
on the list. Is all this basically this
So
website.
what basically what I'm trying to say is like what I'm doing, like like so many people can do. There's so many sites out there that need help with like tasks that can just help like their sites run more efficiently. And instead of working for CROs or sponsors, and they can even it's even like freelancing where they could probably even make more than what they were making because they can get enough business because there is business out there
Look
to
at
be
this
able to do all.
30-minute free call with Jen. Wow. I'm gonna book this. I'll book this right now.
Yeah, would you?
This is great. I mean, the point is, you're gonna get, I want you to get more business, but anyone could do this too.
Yeah, that's exactly it. And it's stuff that like, come on, most CRAs can do quality assurance. One.
That's their job. What are you talking about?
Exactly. Most CRAs can't even build a source because
Well, here's the
they
thing.
know
Hold
what
on.
they
No,
want to
no, no.
see.
Hold on. Let's go back to just that first one. Most
Yeah.
CRAs can do quality assurance. All right. Here's the mentality some of these people have.
And I
I
said
just,
most. Just want you
no,
to
no,
say.
but mo all can do it. Dan, I just got laid off. This is like almost every week.
Mm-hmm.
Dan, I just got laid off. I'm not sure what to do. Market's tough. I'm like, you know what? You sites need help, QA,
You do.
QC, making source.
Data entry.
Then they come back to me and say, but I've never done that. And it's like, no, well, what are you talking about? You know how to do. These sites don't know how to do it. You know how to do it. What is your
You know
response
how
to
to
this?
use the
Because it's
portal.
mind-boggling.
Yeah, you know how to use the portals. You know how to do this. You know what information they want, like how to collect, like how they want to collect it. Like the basics. So you're saying, okay, you've never done data entry, but you've reviewed the data. So you know where everything's supposed to go. So you can't tell someone that you don't know how to do it because you've never
Right,
done it.
right. And when
Because
you
you've done
start
the part on
thinking,
top of it, which is even more important than entering.
this is why I'm sharing your websites. I mean, one, I think it's cool, but number two is like you are not like I mean, you're just a regular PM. Like you were very good, but so are a lot of people that got laid off. It's not
Mm-hmm.
like someone baptized you, Jen
No,
Pages, you are now worthy to do
no,
this. Nobody told you anything. You just did it.
no. I never thought like I would even own up my own business. Like that was never to me. Like when I was little, let's say, or whatever, that was never something that came up to my mind. Like I
But you're not
never
an
thought that
entrepreneur.
was
I think you're
possible.
an entrepreneur. at
Yeah,
heart.
but I didn't know that that was possible for me, like from
Uh,
where I came from. Like I came from very like nothing, like and we were struggling to eat and stuff like that. So
uh,
like I understand where like people can be like, well, that's just not me. No, it could be you. It could be anybody because I came from a place where I didn't even think I could make more than 80 grand a year, if we're being honest. Like
well, if we're being
that to
honest, that
me.
sounded like a lot back in the day for me too.
But like even when like I want to say 4 years ago, I would have never thought like or let's say COVID, I would have never thought that. Like, like I always knew I wanted to make that much or more, but I just didn't know how to do it.
So do you think these jobs, us, well, not us, the industry, keeping people employed for so long kind of took away their skills for fending for themselves? Because they're
Yeah,
basically force feeding them
yeah.
their
It's kind of
incomes.
like when they say you're babying someone and you enable them, we're kind of enabling them to just rely on the big companies, the corporates that are just paying for everything. It's
Yeah,
like
yeah.
that's just what they're used to, what they're comfortable. But in the first month that I had my own business, I think I saw more money than I had seen like that whole year
It's
working at.
crazy. It's
Like, you
crazy.
know what I mean? Like things I
Yeah,
didn't even think I would be able to see. I mean,
yeah.
obviously, none of that is profit because you know how business is, everything's
Of
going
course.
back in. But the fact that you even can even manage that, like, like it's possible. And like this industry, there's so many people and there's so many people that need help. And there's like, I think pharmaceutical companies are starting to install kind of programs in their own thing where they're actually training sites. So
I
that just
saw
tells
that
you
with I think it was AbbVie.
that just goes to show you the need that there is for that.
Yeah, there's a need for new investigators, basically because they need fresh blood for the studies, like they need patients.
Hmm.
Maybe that's number 8, training new investigators.
Yeah.
But that goes
And
with starting a site, I think.
yeah,
Like for me, if I were laid off and I was gonna go train a PI, I
mhm.
would just be like, knowing what I know now, right?
You could just partner with them.
Exactly. But if I didn't know what I know now, I would have just trained with them and learned the hard way after like 3 or 4. Hey, why didn't I just start a site too? Because you do make more money if you run a site well than training a
Yeah.
bunch of PIs here and there.
Yeah, you can have if it's just you, you know how to take out blood, you know how to do all of that. You can literally have two studies and
Yeah,
be good. Like be
be
great.
good.
For the
Replace your
and
salary
you
from
wouldn't even
icon.
you wouldn't even need someone else is what I mean. Like you wouldn't even
Right,
have to hire
right.
anyone else. You handle the two studies, normal amount of patients. You don't even have to
And if you
overenroll.
don't know
Like
draw blood, hire a mobile phlebotomist. They're on call. They're even here in Yuma, like on standby.
or just pay someone to train you.
Yeah, but some of these sticks are hard, Jen.
I know, but I always figure it out at the end of the day. If I
Some things
can't
are not
stick
worth
you,
it.
sometimes if I can't stick you, maybe this isn't the right study for you.
That's sometimes how it goes. I mean,
It's
I've
true.
I've been drawing blood since '05, but I'm not very good. Like I didn't do it a lot, but I can do it okay, but there's some people that are just tough sticks.
I've been drawing blood since 2010, and I think there's been maybe two people that consistently are just hard draws that I can't get.
Mm-mm.
And I stopped calling them for studies.
Damn. See,
I
mobile
had to.
phlebotomist would have helped out.
No, because we would get like people like so upstairs there's people that work upstairs and so we had one of the girls on our delegation log just in case for hard draws.
Yeah.
And so like if it was hard for her and she's really good, it's just the like there's just
Yeah,
some
yeah,
people that
yeah.
are
Yeah.
bad are hard.
Yeah.
And that's what I'm saying. Two in like 15 years, that's pretty
Oh, that's
good.
pretty good. I am way more than that.
So I would just say like those two, I had to stop. Like, but
Mm.
I feel like it's also if they drink water or not. A lot of people just
Yeah,
don't drink enough
yeah,
water.
yeah.
But anyways, that's not the point. I feel like there's ways, like you said, like going into a site and just saying, hey, you want to get into research, not a site, but like a doctor's office. Hey, have you ever thought about research and kind of just telling them about it? Do you know how I feel like that's what people are doing? I don't know if you've noticed. Have you noticed more CRAs? Or most people that were CRAs have sites now.
Not most, but a large
A large
segment
number.
of me and Chris's consulting, we help sites do all the
Mm-hmm.
stuff, get studies, budgets.
He's another one, guys. They know that though, but
Yeah, but
uh-huh.
lately, since
Yeah.
COVID,
Uh-huh.
the largest growing archetype were CRAs, and some of them didn't even quit their jobs. And that tells you how much effort they were putting into monitoring.
Yeah. And let's not not say that out loud, I
I'll
guess.
say it out loud. I'm not gonna say names.
No, I know. But it's true because honestly, I know a lot of people that are doing the same thing. Not just CRAs, but
hmm
they're doing it because it's crazy out there.
And then some of them 5 years later
It's hard.
already sold their sites. Some of them 5 years later doing very good. They're on their third site now.
Some of them even don't even work for the company anymore because they
Oh, no,
realize,
that's a long time ago. Yeah.
yeah,
Basically, within a year, if you do your site right, you will
hmm
have to pick one or the other.
you have to. A
But there
site
was
is
one dude, shout out to CRO, they're a sponsor. He said he could not have kept his day job and on the site without CRO because when he was
mm,
traveling, he used CRO to make sure his staff were doing what they're supposed to do. He was essentially monitoring on his own
yeah,
site.
yeah.
And he said it saved them. Without that, he wouldn't have been able to do it.
No,
So he
yeah.
gives a
Now
shout
with
out to CRO.
everything, the electronic source and all that, and it's so funny because so many people are so against it. The same thing with AI now.
Oh, yeah, I
But
know. I was against CRO back in 2017.
that's so funny.
Yeah.
But it's just if you do it the right way, it's so efficient.
Of
If
course, it's
you,
way better, and it's harder to commit fraud, and it's harder to like it's good for the industry as well.
I do want to say that sponsors are staying away more and more from people who have paper source.
It's a sign that you refuse to adapt, I think.
Yes, or that you're why are you refusing to adapt is the biggest thing.
Right.
I think that's more what they're questioning.
Because you
Why?
can manipulate better.
Is it because of the signatures and the dates?
Mm.
That's what they're honestly asking.
You've heard this being asked?
Yes. Yes.
In
I
what
have I
context?
have a lot of friends that are in sponsors and
What are they saying?
CROs. They're very weary whether or not you're doing fraud or not. If you want me to be straight up,
Yeah, of course we want you to be straight up.
they told me I have a CRA who does SIVs, PSSVs, all of that, and she literally has told me if you still have paper source, I'm gonna think you're doing fraud.
Wow, as the default.
Because at this point the
Wow.
price points that they have these EMRs and stuff at, there's no reason for you not to. I think you
Yeah.
spend more on reams of paper doing these paper
Yeah,
sources
yeah, yeah.
than you would actually just having a system.
Right. Like if you want, yes, agree. I know we're sponsored by Creo. We use Creo. I don't think I'll ever switch, but there are others, smaller competitors that start out bare bones and pretty affordable. Creo's not unaffordable
That's not
either.
affordable.
You pay for what
I
you want, but the more things you add, the pricier it gets. But you could grow
yeah,
into it. But I agree with your friend, whoever that was, whatever they said. You want to
yeah.
give a shout out to them or no?
No.
No. So that's nine things, eight or
No,
nine
I
things.
could say she's a really good friend of mine though. She's like my best friend, so and she doesn't like, name dropping and all that, so that's why I don't do it for her.
Okay, we'll have her on the pod next.
Yes, I'll tell her.
Okay,
She
awesome.
would love it actually.
What else did we miss? Life after a CRO.
Yeah, we said 7, 8 different ways I think that they could make
But you
money.
have to promote yourself though.
Yeah.
Like you
Oh,
do a very good job promoting yourself.
I could do better. I feel like I need to more explain like the things I really do that I could do for
Yeah,
people.
I didn't even know you have Clint Social and I follow you like religiously.
Yeah, I
So
feel like it's that. I have to get better at it, but I feel like I see so many people that just post, "Hey, I do this. Let me know if you need help." I mean, and they get some people. Even if you get one, two people, like you
did you
can
see
make.
Daniel Perez's article? I reposted it the other day. Uh, he's another person I think is still out of a job. Um, but he wrote this article about the industry essentially, like yesterday. I reposted it.
Mm.
But that's putting yourself out there, more from like a philosophical, spiritual sense. But like I think you need to mix the two up. Like you need to let people know who you are, what you do. I think half the battle, like you go to SOS, you go to all the
Yeah.
you go to a lot of, I don't go to any except SOS.
No, I had to slow down.
Oh yeah, don't go to, you know what, wherever you need to go, but SOS is like
Yeah.
basically the main one
Yeah.
you should
Yeah,
come
for
to.
sure.
They're the most fun, no?
SOS
Be
was
honest, which one's the best one?
no, I loved SOS. I loved SOS. Where I probably got the most connections from SOS was pretty good, but I got the most connections from CRS so far.
Yeah, we got them in our radar.
SCRS and CNS Summit was really good, but I do a lot of psych studies, so that's probably why.
Yeah, shout out to Amir Kalali, Dr.
Hmm.
Kalali.
I actually got a free
I saw
admission
that. I saw that.
because of a talent show.
A talent show. Did you play pool?
No, I sang.
You sang. Wow.
Oh my God, that
You
was the
think you
most.
can do a podcast intro song for me?
Sure.
All right.
I'll do it for you.
I'll put it on all the pods.
I'll do it for you.
You
Anytime.
got you like actually sing like for real?
Yeah, I sing on the worship team. Well, I used to sing on the worship team. I was the lead.
Whoa.
Yeah,
All
I was
right.
worship director.
Whose style are you most like
Um, I don't know. I'm more like R&B pop
yeah, like
and
Aaliyah or like
like
or
Ashanti.
Ashanti's
Ashanti.
underrated.
Ashanti. I would say like
Ashanti's
when I was
underrated.
growing up, I think when I was growing up, she was like one of the biggest people that people said I sang like.
Okay, I gotta get a. All right. I
Maybe
would
like
love that
Ashanti.
podcast intro because I
That'd
have
be cool.
one where I talk, but it would be nice to have music, me
In the back.
talking with the music quiet and then the music loud again, and then you know,
Yeah, yeah,
the
yeah.
the interview or the
Oh,
episode.
that'd be cool.
All right,
I like
Jen. All right. I'll give you credits in the show notes. You know we gotta
I
spread
don't
the
care
love.
about that. I don't care about that.
They'll know. I'll say thank you, Jen. Or when I finish each pod, I'll be like, take us out, Jen. And
No,
then your song will come on, baby, 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 baby.
can you imagine? Guru, 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 guru.
I like it. I like it. You gotta
I can't.
think of something interesting.
Okay,
All right.
I,
I love it. All right. Anything else or we're good? I feel
I think
like we gotta do one in person one of these days. But you know where the SO next year? You know where it's at, right?
we're SOS. I think I saw it.
San Diego.
Yes, yes, it was San Diego. I
You
was
love
like,
San Diego, right? Or you never
I
been?
love San Diego.
Okay. Yeah.
I think it's beautiful. It's one
Yeah.
of the most beautiful cities in
Of
the
course.
US
Yeah. Yeah.
as of right now, to me.
I agree. I don't think it's
Chicago's really
changing.
pretty too, but San
Chicago's
Diego
all right.
has those mountains and the water and like La Jolla,
Anything
I
you
think
want.
it's called.
Yeah, La Jolla is great.
Oh, La Jolla is so beautiful.
La Jolla is great. Yep. All right. Well, we'll see you there unless
Yeah.
I see you in Arizona one of these days.
I will be speaking at the SOCRA conference.
What's that?
SOCRA,
That's
the certification company. What do you mean?
I know who they are. Is it in Arizona? Oh, Chicago. Nah, I already went. I already went last year.
2 weeks I'll be in Arizona.
Okay, we'll try to work something out. When?
I'll be with Lee.
I know it, Lee, but when? Like,
Towards the end of the month, probably the 28th-ish, around there.
okay. Hmm. Okay. We'll
We
see.
can see if we figure something out. See, I can just go in earlier, like on the weekend, and then we can, yeah,
Okay.
I have to help train some of his staff.
Yeah. Which is number 7 on your list, I think.
Yeah.
I mean, this
But
can be a whole article.
yeah, most specifically the spirometry though. I think that was one of the biggest things.
Yeah, we
Yeah.
have a few studies with that too, but dude, we got good at it. Well, we got better, not good.
It's more of how you instruct the patient, but yeah.
That's right, because you're with the PM, you were last job I remember, you were respiratory, right?
Yeah, they were
I
doing
remember that.
Hmm.
Because one of the studies we got, I think you were on it, or you were on the sister study or something.
Yeah, I was on the sister study.
Mm-hmm. All
Hmm.
right.
Yeah.
All right. Well, Jen pages everyone. Be waiting for the podcast intro. That'd be great. I'm missing some music, so I'll just put some beats down or something. Or maybe you got the beats too, or you
We
just go
gotta
a cappella.
we gotta talk and see what we're thinking. Gotta make sure it sounds cool.
Yeah, of course, it's gonna sound cool. All
Okay.
right.
Okay, well, thank you so much for having me though. Like you're always so nice
Yes.
and sweet.
Well, of course. Thank you for coming on and sharing. Like people are, I think, are sick of hearing from me. So it's nice to see. And our industry is pretty heavily female dominated, like if I'm gonna be
Yeah.
honest. So they're seeing someone else that's a female that
Hmm.
did it too. Like,
Yeah,
and we're saying the same thing basically, guys.
we are. Yeah, and it's like women can do it and men can do it too. So it's not doesn't matter if you're a woman or not.
Yep. All right. Follow Jen pages underneath this video or in the show notes if you're listening. And maybe if you're listening, you heard her song. Jen, take us out.